What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor & Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor & Home goes the extra mile to protect you, your family, and your home. Carpet One Floor & Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, February 25th. Scott Miniea is with us from the Primaris Foundation. Good to have you here, Scott.
Good morning.
Now, you've been on before and we've talked about open enrollment, right? For health care.
Right, for Medicare in particular.
Yes. So how did that go this year?
We did really well. That's most of the activity that happens with the claim program happens during the annual open enrollment period, or which falls during the fall.
Right.
And about 40% of our work happens then. So it's a very long ramp-up period, the earlier part of the year. And then during open enrollment is the time we really help a lot of folks, particularly with their Part D drug plans, which is where we can help people save a lot of money.
Now, it's too late now in February to do anything, correct?
Right, and it gets a little complicated because of different parts of Medicare have some different enrollment periods. So there are some things that we do work all year.
Like
people
what?
turn 65, people switch out of one type of plan to another. There's certain special enrollment periods.
But I thought you couldn't. I thought once you had a plan, you can't switch.
You can't switch at random. There's very specific rules that are a little too complex for me to kind of get into without confusing people, probably. But basically, what I wanted to share is, in Missouri, we have 1.16 million Medicare beneficiaries, and that number comes from the Census. So we know that those folks exist, and our goal is to reach as many of them as possible with free, unbiased health insurance counseling. And the reason I'm talking about it now, it's not in open enrollment, so it's not our biggest time of the year. But in 2019, we helped about 215,000 folks across the state.
215,000.
Yeah, so we had a lot of folks in our outreach and education activity.
Now,
the other thing is that baby boomers are turning 65 now at the rate of about 10,000 a day. So it's going to go up to 15,000 when that demographic bubble continues shifting.
Now, if you turn 65 this year and it's out of the open enrollment period, there's
an enrollment period for that.
There's an enrollment period for you.
Right, and it gets a little confusing because Social Security age now is shifting, but Medicare eligibility age is not. So 65, you have a window before you turn 65, a couple of months, the month of your birthday, and then a couple of months after, to make choices about your coverage, and we help people with that.
Okay,
those folks are going to see this booklet from the federal government, Missouri Medicare, and on the back of it is our phone number.
Okay.
That's where the claim phone number, claim program. We are the SHIP for Missouri, and every state has one of these. So no matter where you are, that's
so now
a good way to find
if you
us.
turn 65, let's say next month you turn 65. But you're not going to apply for Social Security yet. You still can apply for Medicare.
You can look at a lot of different options, and it gets very complex, and that's why we do the free unbiased assistance. You can contact us, and if you wanted to roll into Social Security, I mean directly into Medicare as you age in, then there are things that happen automatically, but there are also some choices that you can make. And
so
making sure you're picking the best option for you in your situation is really important, and that's what I'm here to talk about, and also to talk about the volunteers we need to get that done.
But what happens if you turn 65 and you go, I'll just wait, and you've waited 2 or 3 months and you haven't enrolled in Medicare? Have you missed your window then?
You may need to wait till the next open enrollment period when you can make a choice. There are certain provisions for certain parts of Medicare. Again, that gets into the weeds pretty quickly. But if you don't make a choice, you may be past a window of opportunity to do so, and then you will pay a penalty when you do need to get that coverage. So that's the big...
The important thing is if you turn 65 this year, go ahead and apply for Medicare right away.
Go ahead and find out about it and make sure you're making an educated, informed decision. One of the things that we do is our counselors, who are volunteers typically, we train them in the ins and outs of all of these rules so that they can customize the service to the individual person or family. And so what we try to do then is say, okay, well, your situation, you have your spouse still has insurance. Maybe you don't have active retirement insurance. You may still work, but you want to look at how do all these pieces fit together?
Confusing.
And
Very
that's
confusing.
where we can really help.
Yeah.
And the other thing is we're mandated. We are a government-funded organization, therefore we have to follow mandates about being unbiased. So some folks say they're unbiased, and they say, yeah, you can pick from any one of our company's plans.
Right. All right. We're almost out of time.
Yeah.
I want to talk about Census, but first, give the phone number that people can call you.
Sure. You would call 800-390-3330, which is the number on the back of Medicare and You, and just request a volunteer packet.
All right.
We do train our volunteers and then support them as they learn how to do this work.
All right. Now, this is a census year, right? 2020 is a census year. How does that affect, why are you concerned about it?
Part of what we do is we work with a network of community partner organizations across the state, about 175 roughly different organizations that serve seniors. And this census is the first census that they're calling the online census, meaning the primary mechanism for counting individuals who are living in Missouri on April 1st is based on an electronic mechanism reporting.
So you're saying people are not going to come to your house?
There will be some of that, but really the main method is to get people to go online. So there will be postcards mailed out. What we're concerned about is we have a lot of seniors who don't have computers or don't know how to use them or don't use them, or they don't have broadband access in their area. So we want to make sure that seniors are not undercounted, because there's a financial consequence for Missouri every time we have someone undercounted, and that consequence, like losing a congressional seat or losing funding for programs, can carry forward for the next 10 years. So it can multiply pretty quickly.
How are you going to be sure that all seniors are counted?
There's a lot of a coalition of groups around the state that are working to get the word out, and that's where we come in. We're talking to people about the census is coming. We want to be a part of making sure you're aware of it, and here's the things that you can expect.
When is Census Day? April 1st?
April 1st is when it starts. There's already ramping up activity.
But do you have to go online on April 1st? And
no, there's a window, and if you don't respond immediately to the online or to the postcard, there are follow-up mailings, but it's not to the extent that we expect that we had 10 years ago. So what we expect fully by next census, the biennial census in 10 years, is that seniors are going to be identified as an undercounted segment, and that's a bad thing. That means we have all these people who are getting older, baby boomers aging into senior age, and if they aren't counted, then the services aren't going to be there accordingly for them. So that's why it's important to us.
Yeah, so you want to make sure if that seniors are counted. If you're a senior, make sure you're part of that census count. And if you know someone who maybe doesn't have a computer or doesn't know how to do it, help them out, because we want to be counted. I'm a senior and I want to be counted. All right. For more information, phone number again. For a claim is 1-800-390-3330. Okay. Thank you, Scott Miniea from Primaris Foundation. Bye-bye.